Hi, I am Sarah Holden. I'm Nora Holden's mom. She's in the second grade. For Career Day, I'm going to tell you about what I do. I'm actually at work right now. My job title is a registered nurse. I work at the University of Kentucky Medical Center in Lexington. My job duties include, so I'm currently a rapid response nurse here. In the past, I have worked in trauma, so like if anybody comes in for a motor vehicle accident or is in the intensive care unit, I took care of a lot of those patients. I've also worked medical, surgical, so anybody who's just coming in for a medical problem and needs to be hospitalized or has come in for surgery and needs to be hospitalized. I took care of a lot of those people. I've always worked inpatient, which means all my patients are here to stay at the hospital for a while. If you do work in nursing, there's many avenues that you can take. There's a lot of people that work in clinics, a lot of people that work, do home health, and there's pretty much anything that interests you, you can connect it to nursing in some way, which is super cool. Because you can continue your education as you progress through your career and discover new things that you like to do. My education that I received, I got an associate's degree, which is a 2-year degree from Bluegrass Community Technical College. It's actually an associate's in applied science, and that's just a matter of getting the right courses under your belt and taking the right things. After I got my associates in applied science, I started a job at the VA. Shortly after that, I transferred to UK, which is where I'm currently working, and they paid for my bachelor's in nursing, which I received from the University of Kentucky. It took about 18 months to get, just under 2 years. So they paid for that degree, which was nice. And then I also have a master's of science in nursing and executive leadership, which is something I just did about 4 years ago, maybe 2 years ago I completed it. And UK also paid for a lot of that degree. And I also just finished my master's in business administration. So business administration goes really well with nursing because there are people at the top that have to run the hospital. So I don't know what I'll do with it, but I at least have it, and UK paid for a lot of it. So that's a great avenue to take in order to get your degree paid for. The way I make a difference is I just look at it as everybody that's here is having their worst day, and if I can provide care to them and provide them with what they need and maybe make their day a little bit better, then that's what I'm here for. And I'm in the midst of a lot of hurt and a lot of heartache, and any way that I can relieve people's pain and suffering is what I plan to do, and that's what I try to do. My advice to you is to really research and look into what you want to do. Know what your likes and dislikes are. You can always I started at BCTC because you can complete your core classes for a lot less money than you can at a university, especially if you're not really sure what you want to do. And then my other advice is just look into whatever degree program, shadow people, talk to people, see if they like their job, see what their job entails. A lot of nursing is moving, or a lot of the business administration that I did was a lot of math, and I don't really like math, and I wouldn't have done it years ago. But nursing has some math, but not as much, and I enjoy that part of it. I enjoy that nursing doesn't have a lot of math. But just look into it, see what you like, see what's out there. And like I said, if you do like math, you can use it in nursing too, because that's what I'm going to end up doing with my business administration degree. So I'm always available to answer questions or talk to anybody if you need anything. Again, Sarah Holden. I'm a registered nurse. Bye.